Welcome to episode 1 of Speak Health's Doctor's Office Etiquette series. So I just wanted to answer a few questions that I have heard quite a bit throughout my time as a medical assistant and also some concerns. So let's get started. So a most commonly heard thing when it comes to scheduling appointments is, why are appointments scheduled so far out? This is a very complex question and it can have so many answers to it, but I'll try to break it down the best way that I can. So before we get down to the nitty-gritty as to why your appointment is pushed out, let's just get down to some definitions of what providers usually reside within a clinical setting. So first we have the MD. MD stands for medical doctor. Then we have a PA, which stands for physician's assistant. And then we have an NP, which stands for nurse practitioner, right? The PA and the nurse practitioner, another term for them when they're grouped together is called APP. APP stands for Advanced Practicing Provider. You might hear that term sometimes. Maybe, maybe not. I don't know. But it's good to know these terms because sometimes people will explain them, sometimes they won't. But when it comes down to scheduling your appointment at your doctor's office, it's important to know these terms because it determines who you're scheduling with. Typically, most people want to see an MD because you have the notion that an MD is the only one that can take care of you properly, which is not all the way true. APPs, same as the PA and the nurse practitioner, actually can do pretty much everything an MD can do, contrary to your belief. They can do full exams and even prescribe your medications. And depending on the practice, some of them can even do some of the procedures that you might need done in a clinical setting. But again, it depends on the practice. But I know, you want to see an MD. That's fine. But one thing to consider when you want to see an MD is that a lot of MDs, they have a lot of things that they do outside of the clinic, which makes their schedule a lot harder to get in. They do seminars and teachings, and they do vacations as well. And because of that, a lot of MDs don't even work a full 5-day schedule. So therefore, they're not even in the clinic a full 5 days every single week. So when you're wondering, why can't I get in to see my MD? Most likely, that's the reason. But again, it depends on the practice. When it comes to the APPs, the PAs and the NPs, most likely they're there 5 days a week, every single week. And they usually work full 8-hour days, like the rest of the staff. Have you ever noticed when you call to schedule your appointment, usually they'll offer you a sooner appointment with one of the APPs before the MD? That's why. It's not that the MD doesn't want to see you. It's typically because they just don't have open availability because their schedule is so condensed and it's so short. A lot of MDs are not in the office. So trust me, the next time you want to set an appointment, try seeing an APP. Not only can they get you in sooner, but you might actually like them a whole lot more than you think. And if you don't, it's okay. You can wait a little bit longer to see the MD. That's fine. Hopefully that answers your question as to why you have to wait longer for an appointment. And even if you have to wait a longer appointment, even for the APPs, it just means they're really, really busy and they have a lot of patients. And if you're not willing to wait that long, trust me, there are other practices that you can find that have shorter wait times. Next question. What do you do if you need an urgent appointment? So depending on the practice, some practices actually do set aside urgent appointments every day for urgent needs. Some practices don't. I recommend to always do your research on the practice in those regards. Usually those urgent appointments are set for same day urgent appointments, and it has to be urgent enough for you to take that slot. A lot of times you have to call the same day and you have to call first thing in the morning because they fill up fast. If the clinic that you're trying to get in does not have urgent slots, usually you can speak to a nurse that's on staff, or I would recommend going to an urgent care or the emergency room. Lastly, when it comes to new patient scheduling, please do your research on what clinic that you are trying to see. It is okay to get online to search up that clinic, to search up the doctor that you're trying to see, but also call the clinic, ask all the questions that you might have, even ask about the schedule. It's okay to ask them, what days is the doctor in clinic? That's okay to ask. It's also okay to ask, what do you do in case of urgent appointments? But one other important thing that I like to reiterate is to ask about your insurance coverage, and also make sure that you get your own medical records. Please do not depend on your previous doctors to send over your medical records in a timely manner. That's one thing that healthcare professionals do not tell patients enough, is to get your own medical records and to keep them with you at all times. I don't know what the miscommunication is with medical records between medical offices, but it's just not good. So one of the best ways to advocate for yourself is to make sure that you have your medical records when you become a new patient at a new clinic, and bring them with you to your new appointment. And do not depend on your previous doctors or previous clinics to send those over, because a lot of times either they are incomplete or they never get sent at all. So this concludes episode 1 to my doctor's office etiquette series. If I left anything out, let me know in the comments, or you can shoot me a private message. But let's move on to episode number 2, because we have a lot of things to cover here. I'm just saying, let's get it.